Have you ever thought about the idea that where you live, like your zip code, could actually affect how long you live? It sounds kind of crazy, right? But that's what we're looking at in this deep dive, this whole connection between politics and how long people live.
Yeah, it's a fascinating area of research, and it's not really about like whether someone is Democrat or Republican. It's more about the policies that are enacted in those areas that really impact people's health.
So we're talking about entire counties that tend to vote one way or the other.
Hmm.
What kind of differences are we talking about here? How big of a gap are we seeing in lifespan between these counties?
Well, one study found that between 2001 and 2019, counties that lean Democrat saw their mortality rate drop by 22%. It's pretty significant when you think about it.
22%. That's huge. And during that same time frame, Republican counties saw an 11% drop. So still an improvement, but nowhere near as big.
Just to clarify for our listeners, when we say mortality rate, we're talking about the number of deaths in these counties, right? A bigger drop means fewer people are dying. What's behind this discrepancy? What kind of health improvements are driving that significant difference?
Exactly. A bigger drop means more lives saved. And we see these improvements across the board when it comes to major causes of death in the U.S. Heart disease, cancer, unintentional injuries. They've all decreased at a faster rate in those Democrat-leaning counties.
Those are some major health issues to be making progress on. So what's the link between those improvements and the political leanings of these counties? Well, that's the million-dollar question, isn't it? Researchers are trying to pinpoint exactly what's going on. But one thing they've found is that many of these improvements, these reductions in heart disease and cancer deaths and so on, they seem to be connected to specific types of policies. And these policies are often favored in Democratic areas. Things like Medicaid expansion, stricter controls on tobacco and guns, a greater emphasis on preventative care. These are all factors that could be contributing.
So it's not really about being a Democrat that makes the difference, but rather the kinds of policies that are more likely to be found in those Democrat-leaning counties.
Right. It's more nuanced than just saying Democrats live longer.
It's about the impact of those policies themselves.
Exactly. And to help our listeners understand this a little better, can I bring back that analogy we talked about earlier of the upstream and downstream villages?
Yeah.
That was fair.
Okay, so imagine two towns along a river, right? One's upstream, one's downstream from a factory.
Okay.
And let's say this factory, as part of its work, dumps some pollutants into the river. Now, the upstream town has clean water. The pollution hasn't reached it yet.
Right.
But that downstream town, well, they're dealing with polluted water because of that factory upstream. Even if they have nothing to do with the factory itself, those people downstream might get sicker because of it.
Makes sense. So the policies are like the factory, and the health of the people in those counties is like the water quality.
Exactly. The policies are those upstream factors that impact people's well-being.
Yeah.
And sometimes those impacts, they aren't obvious right away.
And one policy the article really highlighted was Medicaid expansion. How's that playing into this? How does expanding Medicaid mean people live longer? Good question. So research suggests that states that expanded Medicaid under the Affordable Care Act saw some really positive changes. Better access to health care, especially for folks with lower incomes. When you have that access, you're more likely to get checkups, manage those chronic conditions like diabetes or heart disease, catch those serious problems early.
Which can all lead to a longer life.
Exactly.
Yeah.
Now, on the flip side, the research also found that Republican-leaning counties were hit harder by the opioid epidemic. And that's had a tragic effect on average life expectancy.
Yeah, for sure.
And this brings up the bigger issue of social safety nets. Republican policies often lean toward smaller government, less social spending,
Right.
which can leave vulnerable populations without the support they need to stay healthy, especially with something like the opioid crisis, where access to treatment and support is so crucial.
It's not just healthcare, though, right? The article also talked about things like education levels and income. How did those factors play into this?
You're hitting on something really important here. It's not just one thing. It's this interconnected web of factors. But generally speaking, we see higher levels of education in those Democrat-leaning counties.
Okay.
And that often goes hand in hand with better health literacy. People with more education tend to be more informed about their health, can manage those chronic conditions, and navigate the healthcare system, which, trust me, can be a maze.
And having more money probably doesn't hurt either, I'd imagine. Less financial stress, being able to afford healthier food, better access to healthcare, all those contribute to a healthier life.
Absolutely. Higher income usually means better access to the resources we know are key for good health. Nutritious food, safe housing, quality healthcare. These things are often out of reach for people struggling financially.
So it's like where you live, the policies in your county, those things can actually impact how long you live. It's pretty crazy thought.
It really highlights how important public policy is. It's not just some abstract thing. It really impacts people's lives, even down to how long they live.
It's interesting, usually when we think about our health, we think about what we eat, if we exercise, things like that. But this is saying those individual choices, they're only part of the picture.
Right. It's not that those things don't matter, but they don't exist in isolation. Our environment, having access to resources, a good healthcare system, even just clean air. Policy decisions affect all of that.
So really, what we're talking about is how political ideology can have a real measurable impact on something as concrete as how long people live.
It really underscores just how much our lives, our health, our well-being, even our lifespan, are tied to the decisions our leaders make.
Makes you think, if we know some policies lead to better health, like expanding healthcare access, investing in those social safety nets, focusing on preventative care, shouldn't we be doing those things regardless of politics?
That's the question we got to be asking as a society, right? If we're serious about a healthier, more equitable society, a society where everyone has a shot at a long, healthy life, we have to be honest about what policies actually make that happen.
It's a lot to consider, for sure. And it's not just about politics, it's about people's lives. This has been a really thought-provoking deep dive. If you want to go deeper on this connection between politics and longevity, we've got those articles linked in the show notes. Until next time, keep learning, keep asking questions, and keep the conversation going.